Welcome to this explainer. Today, we're taking a pretty fascinating behind-the-scenes tour of the unseen middlemen of the medical world. You know, when you pick up a prescription or when a surgeon uses a highly specialized device, we rarely pause to think about the incredible logistical journey that item took to get there safely. But behind every single local pharmacy and massive hospital network is a hidden, multi-billion-dollar industry making absolutely sure those critical supplies show up exactly when they're needed. So today, we're going to audit them.
Okay, let's dive right in by defining exactly who these invisible giants are. Under the Sustainable Industry Classification System, or SICS, they fall into a very specific category: healthcare distributors, or HCDI. Basically, these are the entities whose core operations involve purchasing, inventorying, and selling pharmaceutical products and medical equipment. They are the essential bridge between the manufacturers who make the drugs and the hospitals, pharmacies, and physicians who actually deliver them to patients. And their massive scale? Well, it's driven by a super complex web of insurance rates, national pharmaceutical spending, illness trends, and changing global demographics.
So, here's our roadmap for today's audit. 1. The invisible healthcare giants. 2. The sustainability rulebook. 3. Logistics and environmental footprint. 4. Patient safety and counterfeits. And 5. Business ethics and integrity. Let's get into it. All right, kicking things off with Section 1, the invisible healthcare giants.
To really understand their sustainability impacts, we first have to wrap our heads around just how much product they're actually moving. You can't manage what you don't measure, right? So the standard uses these two highly specific core metrics: the number of pharmaceutical units sold and the number of medical devices sold. You'll see them marked here as HCDI000A and B. This gives us a solid baseline to normalize all the performance data we're going to look at later. It basically levels the playing field, allowing us to compare a smaller regional distributor with a massive global logistics powerhouse, measuring their impact per unit rather than just staring at their total footprint.
Moving right along to Section 2, the Sustainability Rulebook.
Now, the SASB standards, which are currently managed by the International Sustainability Standards Board, provide a really specific, industry-focused lens for this. The core philosophy here is financial materiality. This rulebook requires healthcare distributors to disclose specific sustainability risks that could reasonably be expected to affect their long-term cash flows, their access to finance, or their cost of capital. So we're not just talking about doing good for the warm and fuzzies here. We're actively tracking environmental and social risks that translate directly to the bottom line.
Think about the sheer scale for a second. With the massive global logistics required to stock your local pharmacy, using planes, trains, ships, and thousands upon thousands of trucks, how do we accurately track that environmental impact? Well, concern over climate change and fuel pricing directly exposes these distributors to some pretty severe cost fluctuations.
Which brings us perfectly to Section 3, logistics and environmental footprint. When distributors calculate their payload fuel economy, they use this highly specific metric, liters per revenue ton kilometer, or RTK. This measures the fuel consumed relative to the distance the goods were transported and the weight of the actual medical payload, importantly excluding the weight of the vehicle itself. And they have to break this down across air, marine, rail, and road networks. But notice how they have to balance this data against strategic efforts to reduce their impact. They disclose their investments in things like alternative renewable fuels, major fleet upgrades, optimized routing algorithms, and even idling reduction programs.
But, the environmental responsibility doesn't just magically end when a product is dropped off. Beyond minimizing the weight of all that primary, secondary, and tertiary packaging, distributors are audited on a super strict step-by-step product lifecycle process. They have to track the precise weight in metric tons of drugs and medical devices accepted for take-back. Then they categorize whether those items were rapidly reused, refurbished, recycled, or donated. And this is particularly brutal in healthcare because they also have to manage the safe disposal of things that absolutely cannot be recycled. Think mercury-containing products, sharps, and expired, potentially dangerous drugs. Keeping all of that out of standard waste streams is a massive logistical hurdle.
Okay, let's switch gears for a second and ask a critical question. Because while environmental impact and fuel economy are huge factors, the stakes get way higher when we look at the physical cargo itself. We are talking about life-saving medications. So, what happens if that supply chain is infiltrated?
That takes us to Section 4, patient safety and counterfeits. Because distributors share the responsibility with manufacturers to ensure every single pill and device is authentic and safe, the stakes are honestly terrifying. According to the World Health Organization, more than 10% of the pharmaceutical supply chain in low- and middle-income countries is compromised by counterfeit drugs.
That's more than 1 in 10. And actually, this isn't just a developing world problem. It's a massive risk in developed economies too. We're not just talking about harmless sugar pills here. Fake packaging, wrong active ingredients, insufficient quantities, or even toxic substitute ingredients pose massive global health risks and can lead to immediate, devastating patient harm.
To stop these dangerous imitations from ever reaching patients, distributors have to employ a whole arsenal of prevention methods. It's like a high-tech game of cat and mouse. They utilize advanced tech like RFID tagging and barcode serialization to track a drug's exact chemical composition, production date, and processing history, all the way from the factory to the pharmacy shelf. But tech alone isn't enough. They also have to conduct intense due diligence, vendor inspections, deep supply chain audits, demanding third-party certifications for good manufacturing practices, and, whenever possible, just purchasing directly from the manufacturer to cut out those risky middlemen entirely.
So failing to ensure proper dosage dispensing, mislabeling products, or ignoring chemical safety doesn't just harm patients. It directly translates to massive financial liabilities. The SASB standard forces distributors to lay this out super clearly. On one hand, they have to describe their efforts to minimize health risks, like right-sizing package dosages or ensuring single-use items are never reused. But on the other hand, they must disclose the actual total amount of monetary losses resulting from legal proceedings associated with product safety. This includes civil judgments, regulatory penalties, and criminal restitution. It creates this stark, undeniable link between patient safety and financial risk.
Finally, we hit Section 5, Business Ethics and Integrity.
Because they act as the ultimate gatekeepers of healthcare supplies, healthcare distributors are held to incredibly strict legal and ethical standards. They must enforce a really robust corporate code of conduct across their vast staff. This means actively minimizing conflicts of interest, absolutely preventing bribery, carefully regulating how they gather business intelligence, and strictly monitoring all interactions with government officials. And they can't just have these rules sitting in some dusty PDF on the company intranet. They're required to disclose their actual mechanisms of enforcement. We're talking powerful compliance committees, regular internal inspections, and mandatory training programs to prevent false marketing claims.
Ultimately, they must put a hard, unspinnable number on their integrity, and ideally that number is $0. Under metric HCDI 510A.2, distributors are required to disclose all monetary losses, fines, and settlements incurred from legal proceedings associated with bribery, corruption, or unethical business practices. Now, importantly, this excludes their legal defense fees, so this is purely the financial penalty of getting caught acting unethically. It clearly lays bare the monetary risk of failing to maintain strict business ethics in a sector where trust is literally everything.
Which leaves us with this final thought to consider. The next time you pick up a prescription or visit a hospital, we often focus entirely on the retail price of a drug itself. But is the true cost of our healthcare measured just in dollars? Or is it equally measured in the millions of gallons of fuel burned, the mountains of packaging diverted from landfills, the relentless fight against counterfeiters, and the incredibly strict ethical standards required to deliver that care safely? How much of our own health truly depends on the integrity of this massive, unseen supply chain? Thanks for joining me on this explainer, and keep asking the big questions.